good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. While the global fight against HIV/AIDS has made some tremendous strides over the decades, in this post-pandemic world, there are new obstacles. Chief among them, the challenge of sustaining financing and focus. So with healthcare priorities shifting and resources being redirected, are we at risk of losing those hard-won gains? So today on the show to discuss this further, we have Professor Datuk Dr. Adeeba Kamarulzaman, who is the Chairperson of the Malaysian AIDS Foundation. She's also a member of the Global Commission on Drug Policy and President and Vice-Chancellor at Monash University Malaysia. We also have Nik Tasha Nik Kamaruddin, who is the Chief Brand Strategy Officer of Sunway Group. Both of you, welcome to Consider This. Thank you so much for being here with me.
Always great to be on this show, Melisa.
I would love to start with you, Dr. Adeeba, if I may, with the, was it fair to say that healthcare priorities have shifted in a post-pandemic world? And if so, where does the sustainability of the AIDS, the HIV/AIDS programs sit within the kind of resource sharing of healthcare?
Yeah, thanks, Melisa. I think indeed there are a lot of challenges to financing the global AIDS response. It's not just the priorities within health itself. So we have the rise of non-communicable diseases, diabetes, obesity, mental health, and the continued presence and threat of emerging infections and pandemics. But we also have the larger global challenges like climate. And now we have all these geopolitical instabilities. So there are what some people have called polycrises around the world. And so it is not surprising that that the focus has shifted. And on top of that, I guess, with the advance of technology and the tools that we have for HIV/AIDS, some people think that we've already solved that problem. Of course, we have done extremely well, as you've said. We have amazing treatment, we have amazing prevention tools, but we're far from reaching our goals of ending HIV by 2030.
Okay. So talk to me about the Malaysian HIV, the fight for HIV/AIDS, to eliminate HIV/AIDS by 2030, or is it 2050? Forgive me.
2030 is the immediate goal.
Okay.
Yeah.
When we think about the funding scenario for Malaysia, can you lay out the lay of the land?
Yeah. First of all, I think I need to be grateful. I need to be grateful in the sense that for a non-governmental organization, not-for-profit organization, we've done well. Despite it being a controversial issue, I think the government of Malaysia has been behind us for decades, to the Malaysian AIDS Council and the Malaysian AIDS Foundation, with sustained funding for the last more than a decade, and that has allowed us to really implement programs that have shown to be successful, that have reduced the number of new infections. That have we can be extremely proud that for a country of our economic status, that I think it's close to 90% of the funding for HIV comes from domestic sources.
Okay.
Both largely from Ministry of or the government, but also from our very good partnerships with corporations. The challenge is in sustaining this, as you said, because of competing priorities. I should add, our third source of funding is from the Global Fund for AIDS, TB and Malaria. We have been receiving, in Malaysian terms, I guess it's quite substantial amount, but in global terms, they usually put in tens of millions of US dollars. But because of our economic status and also the level of HIV infection, we have enough right now, but the concern is for later.
So talk to me, Tasha, about Sunway's partnership with the Malaysian AIDS Foundation. Where does Sunway come in?
Thanks, Melissa. Sunway started the journey with Malaysia AIDS Foundation 3 years ago, coming to 3 years, where it was actually a very intimate meeting between Prof. Adeeba and our Tan Sri Sir Jeffrey Chia, talking about how Sunway can play a part. And I think, as you know, Prof. Adeeba is a very convincing lady. One of the things that caught Tan Sri's attention was the fact that it was not just about a collaboration, but it's a collaboration that we can trust, you know, because of the established reputation that MAF has built over the years. And I think that is something very important for a company like Sunway to venture into a collaborative effort with, especially with an NGO partner.
So it's not just a kind of financial relationship between kind of donor and recipient, it's more collaborative than that, is it?
Oh, definitely. I mean, we have done above and beyond, you know, in terms of giving funds. MAF has come to our boardrooms to explain how HIV is in Malaysia. They have also come to give talks to our people within the Sunway family to talk about what to look out for in terms of caring for a HIV person or even interacting, because I think not many people know that people don't really know still how to engage with a person with AIDS, and you know, and how to actually be normal or have a conversation. And I think that was one of the things that brought to our attention how of course Prof. Adeeba, but also the whole team is managing that as well in Malaysia, and it's fantastic.
Because Sunway itself is a huge employer, it's a big company, it's a kind of household name. So how you would then, you know, respond to HIV/AIDS and people living with HIV/AIDS would kind of set the benchmark or set a precedent for how other corporates might do the same.
Actually, that's a good point that you brought up, because one of the things that even I was actually surprised was how we embraced the idea from the first meeting, because a corporation like ours usually is quite, not apprehensive, but we're quite guarded in terms of what we support. But I think one of the key things that Tan Sri mentioned in the meeting is this is a fantastic example of how a corporation can help bring dignity back into the lives, into Malaysian lives. And this is one way to show, because if a corporation like Sunway can be involved, why should the rest of the corporate world shy away from a cause like this? And I think that was something that we wanted to not show, but embrace from day one.
So can I ask you, how did you kind of make the case that HIV/AIDS warrants the attention and support of Sunway? Because, you know, as pointed out earlier, there are many other health challenges in Malaysia, non-communicable diseases, dengue, and while very important, HIV/AIDS is the relatively low burden disease in Malaysia. So how did you make the case?
I think for us it's important that they had impact value. Okay. Because for corporations like Sunway, we, as much as we would like to give to as many people as possible, we also have shareholders that we report to, and we need to showcase where does our corporate responsibility funds go to. And Sunway has always been a great supporter of what we need to do for our corporate responsibility to build society rather than more ad hoc in terms of our approach. And I think one thing, compliments to MAF, they do that very well. So in terms of the interim reporting, the yearly updates, it's professionally done. And it's easy to translate that into our sustainability report, for example, because all this matters as we are trying to build a sustainable future, not just for the corporation, but to be a partner in Malaysian society.
So what did you do with the money that Sunway has generously donated?
Well, a number of things. Okay. I think one of the flagship is to take the message and to take the programs to Sabah and Sarawak.
Okay.
So Sunway has supported our programs in Sabah and Sarawak. So we initially worked with Datuk Amar Jamila, who kindly found us a place in Kuching because many of the residents or many of the people living with HIV come from the outskirts of Kuching for their follow-up at Kuching Hospital and travel long distances. So it's like a halfway home
so may
for
I
them.
ask you, had the HIV and AIDS response been Malaya-centric before this, concentrated in the peninsula?
For various reasons. One is capacity, but also in terms of the disease burden. It was more in the peninsula. So for the longest time the effort was in the peninsula. But as the numbers increased in Kuching and in KK, we felt that we needed to venture east. And fortunately, we have the support of Sunway in Kuching and also in Miri and in Sandakan.
So where do you see the most critical gaps in terms of funding?
I think it's in supporting NGOs to carry the work, because in terms of the medications, the Ministry of Health are providing that free medication, which is the same medication that's used for prevention as well, but in one type of drugs instead of three that's used for treatment. But the funding, I mean, someone needs to deliver the services, right? And the reason why we're successful is because we work with peer groups to deliver the prevention messages and treatment care and support. And you see this all over the world, that this community, what I'd like to think of as community health workers, who do the best jobs in delivering services because they've lived the experience, they know the language, they know what needs to be done, are not financially supported. So many organizations macam Kais Pagi Makan Pagi, right? So I think it's to me, it's in the new era of delivering health services. It's not just in HIV. I think we really need to look at community health workers and NGOs as an integral part of the health service. Right. It's not just GPs and specialists and nurses. I mean, the groups of people that we work with, whether they're people who use drugs or men who have sex with men or transgenders, who are not only shunned by society but are criminalized, and because of that they're afraid to go forward to traditional health services. So hence this is where Malaysian AIDS Council and Foundation come in. But it's a model that can be used for any other chronic disease. That's my next part or phase of my career. That's what I would like to champion, because not to mention that we don't have enough doctors, we don't have enough nurses, and the cost, right? So if some of these essential services can be provided by community health workers, we can scale up and expand prevention and treatment services for all kinds of diseases. The model is there. I mean, how do you think Zimbabwe, how do you think Swaziland or Botswana, or name me an African country, deliver tens of thousands of antiretroviral services? They don't have 10,000 Professor Adeeba doing it, right? So it's these community health workers, and we can learn so much from that to deliver, diabetes care, aged care.
Which is one of the things.
Sorry for interrupting,
sure.
But they need to be funded, they need to be trained, they need to be accredited. There needs to be a new model of
Which is
care.
why I find this kind of NGO, corporate, government model quite fascinating as kind of this new era of healthcare delivery. And I'm curious to explore it deeper. So how do we think about this model? What works? What doesn't quite work? What did you need to kind of tweak and get used to? What can be learned from this relationship that's corporate and NGOs and government has entered in fighting HIV/AIDS?
I think to just pick up what Prof. Adeeba said earlier, when we were in Munich, Helen Clark, the ex-Prime Minister of New Zealand, actually gave one of the keynotes, and she mentioned how funding is getting tighter and will continue to be tight. And it's fascinating how this community that has been focusing on one topic is now looking at to be part of a bigger cause that means healthcare in the future. And I think for corporations like Sunway, we always need to work with NGOs or parties that is always looking forward on how to utilize the funds more productively. I remember one of the things she said is that at one point, globally, AIDS was getting a lot of attention, a lot of support, but now not because people are supporting less, but because there's more causes to support. So why not we tie up with relevant diseases across the world and share and make a coalition out of this? And I think as representing Sunway at the conference, this was very refreshing and welcoming, because then we know that it's not a silo mentality thinking on how to use the funds, but it's a movement now to look at how we can work more collectively together and have greater impact. So I think this is one of the things that, well, her session was at 7 o'clock in the morning. I'm glad I went with jet lag and all.
Of scientific conferences.
Yes, and I'm like, who has keynotes at 7? They do, and it's fantastic. But I remember what she said about that, and that was one of the key things I brought back and spoke to my colleagues back in Sunway, and I said, if this is the way forward, we should support movements like this, because it's important, because they're not just thinking about how one particular disease or one particular cure, but they realize now funding is not going to be easy, because there's, as Prof. Adeeba said, there's a lot of polycrisis going around the world. Things are not getting cheaper. So what is the most cost efficient and productive way?
So just, if I may interrupt, a concrete example of this, and Tasha doesn't know this yet, but the drop-in center in Kuching, we're not only making it available for people living with HIV who needs to come to Kuching to access care, but we've also opened it up for people who are receiving chemotherapy, who need to come to Kuching for dialysis. And the reason I said she doesn't know this yet is I've been speaking to the other foundation that I chair, which is Rose Foundation. And Sarawak is interested to expand HPV DNA testing. So we've already got infrastructure there. And you know, by the addition of maybe just one staff, or we train the MAF staff there, I mean, we could deliver multiple, you know, healthcare services. That could be
ripple effects of
Correct.
This.
Yeah.
And who can say that this is not a great idea? You know, so
I do have to
I mean, it's not an insignificant investment, but I think, you know, if we do the maths, the ROI will be significant.
So if there are those who are skeptical about the private sector's involvement in kind of public health initiatives, sometimes there's the criticism that it could be profit-driven, there could be an ulterior agenda. How do you respond to those who have those thoughts, claims?
Well, you know, I think we've been very lucky, and I'm not just saying this because I'm on camera, but you know, what Tasha was speaking to, it is also important for us that we work with people who believe in the cause, and so we have Sunway, we have Yayasan Saim Dabi, Yayasan Petronas, I can name a whole string, CIMB and so forth, who have been with us for a very long time. You know, and it's not just a fly-by-night, here's some money
there
to
is a
NGO,
commitment there.
CSR tick, right? There is a commitment, they believe in the cause. But of course there are also others who you know, just want to tick the ESG, CSR box that they're doing the right thing. Yeah.
And Tasha, how do you ensure that it goes beyond the ESG tick boxing exercise?
A lot of organizations have corporate responsibilities unit, no denying, but I think what happens in Sunway is we actually go with MAF, for example, to the homes of where people have to travel 100, 150 kilometers.
So you get to see
you see it, and you see their living conditions, which is not brilliant, by the way. You know, and once you see it for yourself, you know that the help is reached. And I think I'm quite reluctant on the word corporate responsibility because it sounds very cool, you know, but it is what it is.
It's like soulless.
Yeah, but I think for corporations now, it's not just about what we do. It's about, because we are, Sunway is a family of 16,000 colleagues, you know, and can you imagine when you influence 16,000 people, professionals, and that is a ripple effect to their children and to their families. It's also the knowledge that goes beyond, because I think it's also very important for us to know that, because we can't say staff, community is all one, right? I mean, the people who work in so I think it's very important to believe in a cause so that the employees, as much as the community that we serve, is aware of what we do. And I think that is community building and / corporate responsibility. It is our responsibility, but yeah, that word needs to shift a little bit.
Word, the connotation needs to shift.
So sorry to interrupt, that immersion is really, really important, right? I remember seeing that video of you going to the refugee home. Was it during Puasa?
Yes.
Yeah, and how it leaves a mark.
It was important to experience it first time, for sure.
Sorry to interrupt.
You were in Munich for the AIDS conference, International AIDS Conference a few weeks ago. Did you see similar types of partnerships or collaborations that other countries are doing? Is this a uniquely Malaysian response, or is this in line with what other countries are doing as well?
Actually, when I went, I was quite proud that we were carrying the Malaysian flag and all that, and we were doing something good. But then it was also very humbling to know that a lot of people are doing a lot of good things around the world as well. And as Prof. Adeeba mentioned earlier, how the African nations have brought this up in the forefront rather than a passing topic is admirable. You know, of course, there are people who needs to have other alternate thoughts, you know, but that's what the whole conference is about, is to welcome different thoughts, different solutions to get the best approach moving forward. And this is the first time that I've gone for the World AIDS Global Conference, and I have to say, it's not just an eye-opener, but it makes you think that sometimes when you're doing something local, you think that you're doing the best that you can, but when you look at it from a global perspective, there's other ways of doing it, that you can do more, you can do it collaboratively. And in a world that is getting, for me personally, more and more polarized, it's really welcoming to see that the whole world's gathering together to talk about a topic. And I think that's heartwarming, especially post-pandemic, where things have, I think, gone a little bit more silo than pre-pandemic.
It's lovely because you've been to many of these AIDS conferences. So
since 1998, every year.
I saw her face across all the posters, and I'm like,
but then you get to experience it for the first time, and then still the kind of awe and joy of celebrating or working on a cause together. What's new in the world? What's the latest development in this fight?
Yeah, so before I answer that question, I just want to say that this partnership is the hallmark of the HIV response right from the beginning. You know, sort of the scientific community and the NGO community, the affected communities, the political will, evidence-based partnerships with corporations. I think that's what's unique about HIV, the HIV movement, and also the sort of emphasis on human rights. That actually, you know, the HIV movement's been at the forefront of pushing for not just a biomedical response, but to link it to human rights. So what the AIDS conference does is, unlike many other scientific conferences, is it's not just looking at the science, obviously that's very important, but also the political, the policy, the implementation, and the human rights angle. So hence, we bring together people from all over the world. And many people have come to me at these conferences and said, this is really life-changing. You know, you don't go to a cardiology conference and see, you know, we have something called the Global Village, where people come and debate and dance, and it's really quite something. Okay, back to your question. What was
the latest developments?
developments.
What was happening in the conference?
So I think the most exciting announcement was a study done by my colleagues, largely in South Africa, is an injectable drug called lenacapavir. It was a randomized trial of this injectable drug with taking daily pre-exposure prophylaxis in women, and there were no infections in the group that had been. I'm getting goosebumps that were given the injection twice a year. That's it.
Wow. That's
100%. I know. Lina Gale Becker, who's this wonderful scientist in Cape Town, got a standing ovation when she presented this. Yeah, I'm still getting goosebumps. Now the question is, how do we get this drug to every woman who needs it, who's at risk, as soon as possible?
A glimmer of hope.
Oh yes.
We're almost, we can see the end.
Yeah.
We can see the end. Thank you both for sharing your insights, your journey, your work. Thank you. Appreciate you.
Thank you so much.
That's all we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.